My first day at my elective in Poland. I sure hope that I don't do something stupid.
You're already late and your first patient's here.
My tooth hurts real bad and I've been waiting too long.
Open wide and I will take a look. I didn't know that you are a nuclear physicist, that you have 6 kids and their names are Bill and June, and Marta, Anya, Bruno, and baby Griffin. I'm gonna need to give you some local anesthetics. Little wider, this will just pinch a bit. Stab, stab, stabby, stab. Oh my goodness, I stuck myself with a needle. This is so embarrassing on my first day. What did I learn in Triple I about those needle sticks? Man, Dr. Forgy is such a babe. I wish she was wearing her gram-positive sweater. Crap, I haven't taken any notes about the needle sticks.
First you want to stop the treatment, then notify the preceptor of the incident. If the exposure site is bleeding, let it bleed for a minute. It's a needle stick.
Wash the area with soap and water. Let it last for 10 minutes so you get right in it. Then you wrap it in a bandage. Here's your memory hanger. It's a needle stick.
Memory hangers get me every time.
Now you and the teacher need to fill out the forms. Then you call the needle hotline and you start a report. Tell the patient you are sorry you're as dumb as the court, 'cause you've been needle sticked.
Now it's time to do some questions. Everyone get your eye clickers ready. And don't forget about your memory hangers for the needle stick.
Forgy's so attractive, I keep getting distracted. I guess I'll just pick E again. Click, 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 click.
Whoever keeps pressing E, it's getting old.
Shame, 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 shame.
I hope you know now what to do if you ever get a needle stick.
He's awake, do you remember what happened? You stuck yourself with a really big needle, then you passed out because you are such a noob. Please don't panic, we know what we're doing. Poland and the EU used to have a lot of these injuries, so the European Union made a council directive regarding needle sticks.
There's no time to waste, let's get down to business. Bleed your finger underwater and use lots of soap. We'll check if the patient's blood is infectious. It is, so you must go to the real doctor. We don't count, we're just dentists. But we'll dry off the wound and give you a bandage. Then we'll fill out this report documenting what happened, while you go get some tests and prophylaxis for your needle stick.
Now if this Canadian had used his brain, he could have taken proper safety precautions. Luckily our office has a Dentomatic 5000 time warp. We will just send him back in time so he doesn't end up with a needle stick.
How can you prevent such a tragedy? Well, first you gotta stop daydreaming of Forgy. Get your mind out the gutter and pay attention. So you better have a sharps container. Make sure it's resistant to punctures and is always within your reach to prevent a needle stick.
Gotta practice safe use of your sharps. Don't pass the needles from person to person. Don't bend or break or recap them. That's a really stupid thing to do. Just discard the needle right after it's used to the nearest sharps container to prevent a needle stick.
All of these things are just common sense. And last but not least, you've gotta educate.
Forgy, I'm not sucking up, I promise.